Good morning. This is Dr. Abid Sanaula, orthopedic consultant. I'm going to demonstrate today the safe and correct way of removing sutures. There are different types of sutures. I normally use mattress suture or occasionally single interrupted suture. So, patients of mine, I am happy to give the liberty for them to remove the sutures in 2 weeks' time if they wish so. And this video is to demonstrate and help them how to do it safely. So a mattress suture has got 2 limbs of the suture coming out of the skin, and you need to cut both of them and then pull the remaining part of the suture from the other side. However, the interrupted single suture has got only 1 limb coming out of the skin, and you cut the shorter one and pull the knot out. So here is a demonstration on paper, obviously for making it easier. Now, this is the cut that I made representing the wound, and there are 3 sutures. 2 of them, as you see, this one and that one, they are called mattress sutures as they have 2 limbs, 1 and 2. 1 and 2 near the knot. In contrary, this is called the single interrupted suture, whereby if you see, if I pull the knot, there is only 1 limb coming out of the skin from here. This is the shorter limb, this is the longer limb. Let's start with removing this one. So not to cut the longer limb from here, because then this is the exposed part of the suture to the outer environment, containing potential risk of infection as you pull the knot out, and this portion goes under the skin. And as a result, what you do, you're going to cut this smaller limb here. You can see it's cut now, and then you pull the knot out. And this is the correct way of removing the interrupted single suture. Now, coming to the mattress suture, there are 2 ways of removing it. The idea being not to let the exposed part of the suture go inside the wound and hence causing potential risk for infection. So what you can do is you can pull the knot here and cut both the limbs flushed with the skin, remove the knot like this, and then use this part of the suture, lift it up, and simply pull it out like that. That's one way. The second way is to lift this from this end, loosen it a bit like this. So I'm pulling this end here, cutting flush with the skin there and there, and then simply pulling this knot out.